Hey everybody, Jared Wallen here. Thanks for checking out this video. Ultimately, talking today about lack of transparency in medical bills breeding greed and exploitation from the hospitals and insurance companies. And the reality is that back in 2020, former President Donald Trump, love him, hate him, what have you, not really here to discuss that, but ultimately he issued an executive order requiring price transparency in healthcare for both hospitals and insurance companies, basically laying out on their websites for patients to be able to shop around for healthcare like they do and act like a consumer like they do for any other service or product out there on the market. That took effect in January of 2021. Unfortunately, as of July 2021, only 5.6% of hospitals were in full compliance with these rules, according to a study by patientrightsadvocate.org. And so, unfortunately, we're going to take a look at an example of this today as far as how these folks are obfuscating and continuing to hide behind lack of transparency and deception to make massive profits. And so this is just a quick example from this article. You can see the link here. I'll certainly post that in the link of the YouTube video here. But ultimately, so you can quickly get to it. But ultimately, the reality is you can see here, again, like we've talked about before, medications, transportation, imaging, and labs are commonly areas where hospitals and other centers can kind of gouge you on the cost of things. And so in this specific example, you can see here, they basically got a bill for a patient who went to the emergency room for kidney stone problems, got some labs, got some images, had the workup in the emergency room, and et cetera. And you can actually see here where in this example, they were actually billed almost $1,200 for labs and $6,300 for a CT scan. Now we know transparent prices, labs probably, depending on how many labs they got, probably should cost somewhere around maybe $157 instead of $1,157. And the CT scan would probably be closer to like $350 or what have you, rather than $6,317. And so you can see already right there where very simply, just a quick analysis of this bill, you would save $7,000 right there on the total inflated cost of the product. But remember, that's the markup discount game that we always talk about that the hospitals and insurance companies play. They inflate the costs, and then in this case, they give a self-pay discount of about 50%. But the reality is that if you took the $7,000 off already, then you're already below 50%. And then they should have given a 50% discount beyond that for a self-pay discount. And so they should have really basically been paying a quarter of this bill rather than even 50% still being inflated for just one visit to the emergency room for kidney stones, CT scan, and some labs. And so again, this is just an example where this Sentara in Virginia Beach is really still gouging. And actually, when we look a little bit closer, this article goes in and shows how difficult it is to actually find their prices online. So you can't just go to their webpage and find a full portfolio of prices or what have you, like many other direct pay centers have, like direct primary care doctors offer, like the Surgery Center of Oklahoma, the Texas Free Market Surgery, and the new Surgery Center in Indiana all offer. The reality is that, basically you have to go through, you have to click on the pay your bill link, then you have to go through all these other little steps, 5 different steps to get to where you can potentially maybe find the actual real cost. And even then, they're still inflating it and what have you. And so again, just a quick example of how the markup discount game, how price transparency, how lack of transparency and deception are harming Americans and really allowing these big insurance companies and big hospital systems to profit off of all of us. So like and subscribe to the video, check it out, check out our other social media channels. Thanks so much for watching. Y'all have a blessed day.